Clinical trials are starting this week to evaluate Pfizer's COVID-19 vaccine on pregnant women. This as more states are moving pregnant women up on the list of groups eligible to receive the shots. But as Madeline Anderson joins us live to explain, there's been no mention here in Wisconsin of including those who are pregnant, right?
Yeah, that's right. Pregnant women here in Wisconsin can only receive the vaccine if they are already part of another group that is currently eligible. Meanwhile, women who are pregnant are at increased risk of being hospitalized if they contract the virus. Expectant mothers have yet another major health decision to weigh amid the pandemic, whether or not to get the COVID-19 vaccine. At 14 weeks along, Wauwatosa resident Zoe Hastert will likely be eligible before she's due to give birth in August.
I would like to be vaccinated, late second trimester, third trimester, so that my next daughter, I'm pregnant with a girl, can have antibodies as well.
But many women in Wisconsin who are due earlier may not ever have that opportunity. People who are pregnant are currently not eligible for the vaccine as part of the state's phases 1A and 1B. The CDC's Advisory Committee on Immunization Practices recommends states include pregnant women in phase 1C. Not only are they at increased risk of serious complications and death from COVID-19, the CDC says the infection may cause preterm labor.
I think it would be a misstep on the state's part, to be completely honest, to not open this up to another group of at-risk people.
While places like New York, Illinois, and Tennessee have already taken steps to expand vaccine eligibility to pregnant women, there's been no similar discussions in Wisconsin. When I asked why not, the state's immunization program manager dodged the question.
Certainly, if a pregnant woman falls into one of the categories, such as currently being a healthcare provider or such, they would be eligible for vaccination at this time.
Hastert says getting vaccinated is ultimately a personal decision, but one that pregnant women should at least have the option to consider.
Being able to take advantage of that early on, helps my baby, helps my family, helps with the data collection and the research.
And data on COVID-19 vaccine safety during pregnancy still remains limited because pregnant women were not included in clinical trials up until now. Women who do have questions are urged to talk to their doctors. Reporting live in Milwaukee, Madeline Anderson, FOX6 News.
Yeah, I definitely want to talk this out with your physician. Madeline, thank you.